What's up, San Diego nurses? Dr. Bo here, and I have my beautiful girlfriend Krystle with me, who happens to be an ER nurse. And what we're gonna do is show you guys today how you can benefit from chiropractic care. I'm gonna be adjusting Krystle, and she's gonna share with us some of the most common areas that tend to get injured and some of the common symptoms that you get from working those long hours and late into the night. So you guys know all that better than me. So please, if you have any questions or comments, feel free to comment below. If you feel like you really enjoy this video, share with other nurses, because our goal is to help out as many of you as we possibly can. So make sure to watch to the end. And go ahead, Krystle, tell the people a little bit about yourself and your experience in nursing.
So I've been a nurse for about 9 years, and I've worked in many departments like cardiac, urgent care, and ER. And one thing I've noticed is I've always had tension headaches and pain in my upper neck and my left hip, which means that I was basically leaning to one side. I've been under chiropractic care for about 2 years now, and what I realized is that because I lean to one side, it's important for me to get aligned, because the aches and pains just really interfered with my sleep. I was having trouble focusing. So now that I've been dating Dr. Bo, I get my frequent adjustments and I no longer have tension headaches. I sleep better, and from lifting patients frequently, the lower back pain has really gotten better.
Awesome. Yeah, so we're gonna share with you exactly what we're gonna look for, and we're gonna get it adjusted. So watch and enjoy this video. So we have a very thorough process where we do a full consultation to understand how stress has been impacting your body. This is something that I've already done with Krystle here, and we've done a full spinal exam with her as well. We've taken x-rays, so we have a great understanding of where her body currently is at. What I'm gonna walk you through here is just a step-by-step process of what it is that we look for before we perform a chiropractic adjustment. And I'll just explain to you some of the areas that are typically get tight and tense, and how we can help alleviate those areas via the adjustment. So she's gonna go ahead and lie face down for me. And all she's gonna do at this point is just take some big deep breaths in and out and relax on the table. So one of the first things that we look for is an imbalance in the feet, okay? And oftentimes, as you mentioned, Krystle was mentioning that she was having a tendency to lean more on one side than the other. And what we often see is people will have an imbalance. It could just be even 1/4 of an inch, but some people 1/2 an inch, and you have legs that are gonna be shorter than the other, which is gonna create tension that travels up the spine. So Krystle has been getting adjusted regularly. Her legs are currently even, and they're gonna remain even in the second position as well. So that's great news right there. What we're gonna take a look at to start is the upper neck and back area. What you're gonna commonly see, as she was sharing with us, is that she gets a lot of neck tension that builds up. Whether you're charting, you're doing those notes, you're tired, the head goes forward, you're gonna feel a lot of tension that builds up there. And last but not least, the emotional tension that we get whenever we get really stressed out at work, where it pulls on those traps as well. So certainly, even though she has been getting adjusted, there's a lot of tension that's built up in her traps, levator scap as well. And what we look for is motion in the spine. If the area gets really stiff, it means that you have decreased neurological flow and decreased blood flow to the area, and you have muscles that start to harden. And we don't want muscles that harden, but we rather want them to be soft. Right, so after a decade of nursing, you can certainly expect tension in the upper back area and the neck, and then lower down as well. So one of the things I'm feeling for right now is movement, and I'm feeling if any part of her pelvis or her lumbar spine is misaligned. And one of the things that's happening here right now is there's a rotation in the sacrum, which is gonna make these muscles feel tight and tense. So if you feel in your lower back and you feel like one side is tighter than the other, that may be an indication that you have a misalignment, or what we call subluxation, in your low back. The other thing that's happening here is I palpate her lumbar spine. We have mild spasms that are occurring, and that's due to a protective mechanism. As the body feels like it's not safe to move to certain areas, it's gonna hold on and protect. So what we certainly wanna do is adjust a few areas here. So for her case, it's gonna be the sacrum on this right side, L5 on this left side. Since I know her spine real well, I know this is an area of tension that we always get amazing release. So let's go ahead, Krystle, what you're gonna do for me, you're gonna have this side up facing me. Awesome, I'm gonna bring one leg here, and she's such an awesome patient because she knows how to get in the perfect side posture here. And now, keep in mind, she's been getting it adjusted for a while, so she's very comfortable getting adjusted. And when you first start off, typically start off a whole lot gentler, but we know that she works hard, and we're gonna go ahead and just turn this right here. You're gonna take a big deep breath in for me, let it all the way out. Perfect. Whew. Amazing. She's gonna go face up for me, so go face up first. And one of the things that she'll complain about is hip, right? So the hip can, in the socket, get tight if we sit a lot. the hip flexors get tight. So what we want to do is traction that out. And this is one of her favorite moves. She's gonna hold on to the sides. She absolutely loves this. Let the head relax. Amazing. Let it relax right there. Perfect. And I always tell the ladies, you can get a little bit taller from this as well. So if you're in that 4'11" range, you can get to 5 feet for chiropractic care. Beautiful. We're gonna go ahead and address L5, so we feel the muscular tension there. She's just gonna breathe out, let everything relax, and right there, awesome. Beautiful. Now very commonly what we see is also a correlation between, let's just say, menstrual pain and low back pain. And if that's something you're commonly experiencing, we do actually get, fairly good results when it comes to that, because all the nerves that go to your low back, they travel down your legs and they're gonna control your excretion and then your reproductive organs as well. Now when it comes to the mid-thoracic spine, that's what's gonna control your digestive organs. You can go big, big, deep breath in, all the way out. Beautiful, easy peasy. Awesome. So that's gonna help alleviate some of the tension in the upper back and the neck. And what we're gonna do now when it comes to headaches, the most common area, top of your neck here. So if you were to just touch and feel, we have any area in your upper neck here where the suboccipitals lie. If you feel a lot of tension or tenderness there, that may be an indication that you have a misalignment. And I know for a fact with Krystle, it's usually the atlas, the right side. That's where she carries her stress and it pulls it out on that side. So very common that we see alleviation of headaches come from that. So I know right there, it's tender. There's a lack of motion occurring as well. So we're certainly gonna get a good release there. And the other segment for her is usually C6 lower down. So if you ever experience upper trap pain that shoots down into arms, or even numbness, anywhere from T1 to C5 is where it could be coming from. So let's go ahead and we're gonna open up the atlas first. So what she's gonna do for me, just lift that head up just a little bit. Everything all the way relaxed there, let it relax. You wanna make sure that there's no tension there, all the way relaxed, beautiful. And then go ahead and lift your chin up just a little. So very, very light. The sound is just gas escaping out of the joint. She's got a very big smile on her face, so we're gonna go ahead and help her up. And when you first start getting adjusted, it's typically a little bit of a longer process. She's been getting adjusted for a while, so that's essentially what we're looking at. So share with the folks, what do you typically feel, before or after an adjustment?
Honestly, it's a huge release. All of the pain just goes away. I sleep better. I walk away feeling a little more loose. I can go to the gym. It's actually better when I work out too, because now I can lift without the pain kind of stopping me.
Awesome. And then at what point do you feel the pain comes back? Because obviously we get back to work, we're lifting patients up. So how long does it typically last for you? Let's just say, in those when you're working 3 12s in a row.
Well, definitely after the second day, I'm feeling tight again. So it's beneficial for me to get adjusted at least every 2 to 3 days. Awesome.
And then the big thing that we're also about is that, as we've shared in the other videos, is about exercise, stretching, doing yoga and things of that nature. And that's how you're gonna get the most out of your chiropractic care, but also help alleviate your stress. So we're all about the holistic approach here, where I know she's very big into meditation. We go to yoga together, we exercise together. So you need to take this whole approach. And if you're curious how it can benefit you, feel free to click below and see how it can help you out. Thank you for watching the video. We appreciate it, and we've got plenty more content coming soon.
Bye.